Good afternoon, everyone, and welcome to the third episode of our webinar series, ASEAN-Japan Insights. Thank you to everyone for taking the time to join us for this occasion. The ASEAN-Japan Insights series is an ongoing initiative that aims to be the leading information sharing platform on key ASEAN-Japan matters. Our speakers comprise of leaders and experts from industries, academia, governments, and enterprises from within the region. Our previous installments in the ASEAN-Japan Insight series unraveled the complexities of establishing carbon markets and cross-border digital payments, all in the name of envisioning a future of further regional cooperation in key areas of sustainability among ASEAN countries and Japan. Join us today as we examine current advancements in digital health and dive into interoperable digital infrastructures, trust building through data protection and governance, and supporting digital health startup innovations. Through presentations and discussions featuring experts from the Malaysian Research Accelerator for Technology and Innovation, or MRANTI, MEDRING, the Singapore Agency for Science, Technology and Research, or ASTAR, and the Tokyo Foundation for Policy Research, we shall explain the challenges, potentials, and opportunities of establishing digital health collaborations between ASEAN member states and Japan. To formally begin our webinar, may I call on the ASEAN-Japan Center Secretary General Hirabayashi to say a few words. Secretary General, please.
Thank you, Aurora. Very good afternoon, distinguished speakers and participants. Mr. Mohammed Hazwan Daud of Malaysian Research Accelerator for Technology and Innovation, Mr. Takanori Fujita of the Tokyo Foundation for Policy Research, Ms. Fong Yuan Lu of Singapore Agency for Science, Technology and Research, and Mr. Kazuma Abe of MEDRING. Thank you all for joining us today, despite your very busy schedule. I feel today is like All-Star Games. A special thanks also to our moderator, Dr. Katrina Navallo, Program Manager of our Center's Research and Policy Advocacy teams. Your expertise is sure to spark vibrant discussions on today's crucial topic. Friends and colleagues, it is my honor to welcome you to the third installment of the ASEAN-Japan Center's ongoing series entitled ASEAN-Japan Insight. But this platform is dedicated to fostering collaboration and the knowledge exchange on the crucial issues and shaping our region and aim to eliminate the ever-evolving ASEAN-Japan relationship. Our previous webinar on carbon emissions trading highlighted the necessity of strengthening domestic carbon trading system, yes, both for voluntary and a compliance market, and aligning with global standards to create robust market. Participating in joint crediting mechanism between countries, including Japan and ASEAN member states, can open the possibility for cross-border emissions trading. Today, we will embark side by side on the journey toward a sustainable and interconnected future. This time, we shall explore the future of digitally connected health systems in Japan and the ASEAN region. The COVID-19 pandemic significantly disrupted medical care and health services, leading to a surge in the use of telemedicine or telehealth and the various health digitally connected technology in Southeast Asia. With the rise of generative AI and machine deep learning, we may soon see significant leaps in what digital health technology can do to improve access to health and health service delivery. Today, a fitting time to discuss and imagine what a digitally connected health system looks like. This webinar aims to do just that, and we have with us experts and industry players from Japan, Malaysia, Singapore, and Vietnam to share developments within the region to realize digitally health integration or connectedness. How do we protect health system from the threat cybersecurity? How can we increase trust in the technology? What skills are necessary for future digitally health professionals? And what is the future of digital health in Japan and ASEAN? Well, these are just some of the questions we will be addressing today. Our webinar is testament to the ASEAN-Japan Center's commitment toward an innovative and digitally connected ASEAN region. Through the ASEAN-Japan Economic Co-creation Vision and the future design and action plan agreed upon by our head of state and the government of ASEAN member states and Japan in 2023. I really look forward to the insightful exchange initiated by these esteemed experts and to the rich discussion that will undoubtedly emerge from these series. Thank you for being part of this synchronous endeavor. Together, let us pave the way toward a more sustainable and prosperous future for people in ASEAN and Japan. Thank you very much.
Thank you, Secretary General Hirabayashi, for giving us your opening remarks and for setting the context for today's event. Lastly, before we get into the content that everyone is waiting for, I would like to quickly introduce our panelists. Dr. Katrina Navallo will be our moderator. She serves as Program Manager of the ASEAN-Japan Center's Research and Policy Advocacy Team. Dr. Navallo recently published a report entitled Assessing Digital Health Adoption in ASEAN, co-authored with Tech for Good Institute's Keith Detros. We are privileged to have with us as well representatives from national ecosystem builders. From the Malaysian Research Accelerator for Technology and Innovation, we have Dr. Muhammad Hazwan Daud. Dr. Hazwan is currently the head of Emiranti's Health Tech Hub, an initiative that was launched to facilitate the advancement of homegrown innovation in various healthcare areas. Dr. Hazwan's perspective will be invaluable for this conversation. We are also privileged to have with us Mr. Takanori Fujita, a senior fellow at the Tokyo Foundation for Policy Research. Mr. Fujita specializes in medical law and medical policy, especially legal systems and ethics related to the handling of medical information, including medical AI and online medical care. He also serves as a member of the Cabinet Secretariat's expert panel on contact confirmation applications. And from the Singapore Agency for Science, Technology, and Research, we have Ms. Ho Yuan Lu. Ms. Lu is the Vice President in Outreach and Talent Development of A-STAR's Diagnostics Development Hub, Singapore's national platform for diagnostics development, dedicated to transforming the medtech landscape in Singapore through innovative solutions from both local and regional partners. Ms. Lu will shed light on Singapore's efforts to cultivate a thriving medtech landscape. And finally, to give us a startup perspective of the topics at hand, we are privileged to have with us Mr. Kazuma Abe, President and CEO of MedRing. Founded in 2019, MedRing focuses on developing smart clinics and digital healthcare in Asia, with offices in Vietnam and Indonesia. Mr. Abe also previously served at Japan's Ministry of Economy, Trade, and Industry. He will walk us through the process of building a sustainable business model in digital health. With that said, let us head right into what our speakers have prepared for us. Let us start off with a presentation from the ASEAN-Japan Center's Dr. Katrina Navallo. Dr. Navallo, please.
All right, thank you so much, Aurora, for the kind introductions. I hope the audience can see the screen. I would like to share that this research conducted by the ASEAN-Japan Center entitled Assessing Digital Health Adoption in ASEAN looks at the scale of readiness or the level of readiness of the ASEAN countries based on an existing indicator called Global Digital Health Indicator, published by the Global Digital Health Monitor and supplemented by key interviews with selected government and private sector leaders in ASEAN, several ASEAN countries and Japan. Now, as an outline, I would like to go through these 4 contents, and in the interest of time, I'll be breezing through some of the slides, so I hope you will bear with me. In 2023, the World Bank published the following 3 stages towards a mature digital health ecosystem. At the earliest level, we're looking at digitalization, where we lay the architectural framework and administrative processes for health information systems connecting health providers and facilities and collecting standardized medical data. Based on our assessment of the ASEAN countries, this is where most ASEAN countries are in terms of their digital health preparation. The second stage is digital for health, where medical data and digital technology become part of the daily business processes. And the final stage is the full realization of digital in health, which envisions the merging of digital technology and health data into a seamless process that is embedded in mature and transformed health systems. Based on our assessment, we have found the following 4 players in our regional digital health ecosystem. We have the regulators composed of the governments, medical professional associations, and regulatory bodies in each country. We also have innovators consisting of startups, service providers, and social innovators. Enablers consisting of governments and also investors, and also the users, including patients, healthcare professionals, and insurers. Based on this top 50 Southeast Asian health tech by Holon IQ published recently, we can see that there is a growing ecosystem of digital health providers in the region. We can see that along the value chain of the digital health, we have providers, diagnostic providers, supply chain providers, finance and insurance, and also from the prevention and hardware, and even from the workforce. But most of these, we can see these providers are also working along the space of the telehealth and national electronic medical records. Now, the question that the report aimed to answer is ASEAN digital health ready? To give us an assessment of the current capacities, health capacities of the ASEAN countries, we plotted them on this radar graph and looked at the following data composed of the density of medical doctors, nursing and midwifery, pharmacists, dentists, and hospital beds per 10,000 population. We can see that ASEAN countries are huddled together towards the middle. And when you look at this radar graph, the bigger the axis of the scores of each country, the stronger its capacity for health system or health workforce. We can see here that Japan, in the color pink, is relatively strong in terms of the service availability. And we can also see that given the, we may not see here, but Singapore also has a strong performance. Given its limited population of 5 million, there is relatively a good ratio of health professionals according to the population. So we can see in this slide that there is much gap in the remaining countries in ASEAN, particularly in Cambodia, Myanmar, and Laos, while Brunei, Indonesia, Thailand, Philippines, Vietnam, and Malaysia are relatively moderate in terms of their health workforce capacities. We also looked at the Universal Health Coverage Index, and we can see that in terms of the population, Indonesia has a high population, and its coverage of universal health system is almost 60%. At the topmost, we can see that Singapore and Thailand and Japan, Singapore and Thailand as ASEAN countries are relatively high in scope in terms of their universal health coverage, while the remaining countries in ASEAN are in varying degrees of coverage. We also looked at the digital readiness of ASEAN countries to look at how their connectivity in terms of their infrastructure, technology, people, and governance and impact are performing. We base this on the existing index developed called the Network Readiness Index, which measures the country's performance across these 4 pillars. And we found that across the 6 ASEAN countries that are included in the database, there is a strong performance in terms of their digital readiness in the areas of impact and governance, while there's still room for growth in terms of the people and technology pillars. And also, to look at the digital health readiness of the ASEAN countries, we use the Global Digital Health Index, which is published by the Global Digital Health Monitor, and which assesses the country's performance in terms of the following 7 indicators. So this index looks at leadership and governance, strategy and investment, legislation, policy and compliance, workforce, standards and interoperability, infrastructure, services, and applications. The report utilized this index given its relative holistic approach towards assessing using the following indicators. And while there are also other available indicators, we felt that this also aligns with the World Health Organization's indicators for e-health and digital health. Now, in terms of the readiness, we've seen that Singapore actually scored very high in all 7 areas. And relatively, the ASEAN countries, Brunei, Indonesia, Malaysia, Philippines, Thailand, and Vietnam are actually performing well in terms of their readiness based on this assessment. Meanwhile, Japan, Laos, Cambodia, and Myanmar would still have some catching up to do in terms of the different areas, in terms of services and applications, workforce, technology, among others. In the interest of time, we could not go through on each country's assessment, but for those who are interested, the digital health, the Global Digital Health Indicator is available online, and we'd be able to share that with you later on in this presentation. Based on our assessment and also from interviews with the key participants that we have talked with, we have come up with the following 2 main challenges and gaps. The report is not, these 2 challenges are not exhaustive, but we felt that given the main concerns and challenges faced by the interviewees in this report, these 2 ranked as the topmost challenges and gaps. And that includes lack of trust in data protection and cybersecurity and fragmented digital health systems. And so the report offers the following 4 strategies. First is to build trust through data protection and governance, develop standards for data interoperability, enabling digital startups to drive innovation, and promoting healthcare professionals' digital health training support. Going through the data protection and governance, we looked at the availability of laws and policies governing telehealth and data protection in ASEAN and Japan. And we saw that among the ASEAN countries, Indonesia, Malaysia, Philippines, Singapore, and Vietnam have at least set forth preliminary laws or even instituted laws that are governing data protection and even regulations specific for e-health, telemedicine, and digital health. In terms of developing standards for data interoperability, the lack of established and integrated digital health infrastructure remains one of the most main challenges. At the most basic level, some countries have started already digitizing medical records at the national level. Singapore, Malaysia, and Indonesia have made efforts towards a national electronic medical record system, albeit in varying stages of implementation. However, the seamless utilization of medical data across various platforms remains a challenge among these countries. If you can see here, we have also collated the existing laws and policies across the 10 ASEAN countries in terms of telemedicine, telehealth, data privacy, and data protection. Based on the third strategy, we also highlight that aside from having traditional healthcare industry players such as hospitals and clinics to adopt digital technologies, digital health experts point to the importance of startup companies in advancing the digital health ecosystem. Startups play a huge role in driving or developing tech-enabled solutions that further promote digital health adoption for users and introduce innovative business models. To foster innovation in the healthcare industry, countries such as Singapore and Malaysia have established dedicated agencies to support digital health startups. As you will see later on from the other speakers, they will be sharing more about this case in their country context, and we will not be preempting it with that. However, identifying a successful business model and proof of concept with actual market value and demand is just one step in promoting innovation. Governments should also promote market entry for digital startups by enabling a level playing field and allowing startups to scale up and grow to have meaningful impact in the healthcare industry, and this can be in the form of sandbox initiatives. For example, Singapore, Malaysia, and Indonesia have sandbox programs with respect to their digital health technologies. At present, one of the main findings in terms of the challenges involve the limited availability of digital-ready healthcare professionals and tech supporters. And this has been echoed by several health officials that we have interviewed, and noting that since the priority is largely on infrastructure development, streamlined training of health professionals have not been adequately supported due to public limited resources. So there is an ample opportunity here for the inclusion of digital health subjects in health education curricula, in continuing professional education courses, and in postgraduate studies. To sum up, the report highlights the following 4 strategies. And I believe that in our panel discussion, we will be hearing more about these strategies and how ASEAN and Japan can foster closer cooperation in these areas. So for those of you who are interested, we would like to encourage you to scan this QR code to download a free copy of the report. For any questions, we'll be happy to address them. And for any clarifications regarding the report, please feel free to contact us at katrina@asean.or.jp. This ends my presentation. I'd like to give the floor back to Aurora.
Thank you, Dr. Navallo. Next, we will be hearing from the head of Health Tech Hub from Emranti, Dr. Hazwan Daoud. Dr. Hazwan has provided us a recording of his presentation as he is unable to join us live today. May we show the recorded presentation, please?
Hello and good day, everyone. My name is Hazwan. I'm currently heading the Life Sciences Department in Meranti. So basically, Meranti is an agency under the Ministry of Science, Technology and Innovation of Malaysia. Our mandate from the government is basically to accelerate demand-driven R&D and eventually commercialization of local technologies in Malaysia. So this is basically just a very brief introduction about our agency. Our vision is Malaysia as the nucleus for innovation and a leading technology producer nation. As I mentioned previously, our mission is basically to accelerate the development of demand-driven R&D in technology and innovation, and eventually to accelerate commercialization of these technologies in the market. We have few impact areas. Basically, these are all the We call it impact house, in which in everything that we do, we need to tie it to one of these impacts. So basically, as you can see, one of the particular impacts that is being highlighted here is basically to address national challenges, food security and healthcare using 4IR. So healthcare or health in general is basically one of our core technology focus areas in Meranti. So basically, as technology commercialization accelerator agency in Malaysia, Meranti is also tasked or being entrusted to run uh, uh, a technology innovation park with a total area of close to 700 acres in land size, located in Kuala Lumpur, which is the capital city of Malaysia. Basically, by having this infrastructure, which are being designed to support, nurture the innovation ecosystem in Malaysia, and complementing it with our developmental programs, Meranti is better positioned to provide facilitation to our local ecosystem, local and also international innovation ecosystem, and this area also serve as a launching pad for our startups company to grow and also to scale up in terms of their business and innovation journey. So, being a government agency, we cannot focus on everything under the sky. So, although we facilitate companies, startups, technology companies, regardless of their technology sectors or verticals, however, Meranti itself, we have sort of defined our technology focus areas that we foresee will bring the most impacts to the country. So in terms of technology focus area, as you can see in the diagram, we have two main technology focus area. We have life sciences. So I'm heading the life sciences unit, covering health tech and also agri-tech and biotech. And another technology vertical that we are focusing on is the autonomous technology, covering drone tech and robotics and also autonomous vehicle. In fact, the entire Meranti Park, the entire road in Meranti Park is basically gazetted as AV, autonomous vehicle test bed. So basically, on top of that, we also have sort of focus on integrating the element of sustainability, 4IR technologies, and also 5G connectivities in terms of enabling this technology to be implemented in real world settings. So within the life sciences, as I mentioned previously, we have one focus area that we call it health tech. So within this health tech unit, we have what we call the health tech hub program. This program was launched in September 2022. So it's about 1 year and 10 months by now. It's a dedicated program designed to provide facilitation to innovators throughout various research and development and commercialization and innovation stages in 6 core areas. So number one, we have pilot and validation. Pilot and validation, we are working closely with some of the government hospital, some of the university hospitals here, and some of the private hospital. In total, we are working with close to, right now we have around 13 hospitals that we are working very closely with to basically as a sandbox environment to provide a test bed location for our innovators to test their solution. So this is basically targeted for innovation at the stage of TRI 6 or 7. Basically, those who are yet to secure any regulatory clearance and they would like to test their solution in a controlled environment. On top of that, we also have what we call a POC. Is basically a technology that's ready to be commercialized, to be tested in a hospital or basically in a government or in a private hospital with the intention of procurement. So throughout this what we call the POC period, we will conduct health technology assessment on top of the other assessment as well through the adoption of technology to basically understand the impacts of the technology and to basically support the decision maker in making their decision in procuring our solutions. Number two, we have capacity building program. As a technology commercialization accelerator, we have our own accelerator program. We have our own boot camps that are being designed or rather targeted to provide facilitation to local innovators in terms of setting up their companies. We also have a dedicated program basically to enable or to facilitate international companies to come to Malaysia through this through our innovation development department. On top of that, we also facilitate in terms of regulatory requirements. We are working closely with the regulators, the medical device regulators, and also the pharmaceuticals and supplement, and also the TCM, Traditional Complementary Medicine regulators here in Malaysia, basically to provide a framework to enable disruptive innovation to be adopted and to be implemented in real world implementation. We also run a program to provide funding and investment. Basically, funding, we as a government agency, we sort of operate the grant program on behalf of the government. It's called Strategic Research Fund. Basically, it can go up to 15 million ringgit per project, and the purpose of that is basically to tackle the valley of death in the innovation journey. So that's around the prototyping stage and also the regulatory clearance stage. And then we also have investment. We are working closely with VCs, venture capitals here in Malaysia, and realizing that there's quite a limited number of VCs in Malaysia. We're also working with regional VCs as well through our partnership with AWS ASEAN. We have been basically connected to a network of regional VCs that we are currently tapping on in terms of providing potential funding to our innovators. Market access is another thing that we are offering basically through our partnership with the hospital, healthcare institution. We basically mesh the right solution with the problem statement provided by the hospital, uh, basically as a POC, as I mentioned previously, as a POC, with the intention to procure the solution. On top of that, as I mentioned previously, we also run a market access program for international companies to come to Malaysia to set up your entities, and on top of setting up your entity here in Malaysia, we also provide facilitation in terms of potentially linking you up with potential customers in Malaysia and linking you up with other agencies, our sister agencies, in terms of providing incentive, for example, tax relief or and something similar, workers permit, for example, for international entity to set up your local entity here in Malaysia. And finally, we also we also facilitate in terms of strategy partnership. For example, if you're looking for technology and business matching, this is where we will be able to facilitate you through our database, our rich database of currently more than 200 companies, health tech companies in Malaysia. On top of that, as I mentioned previously, Meranti, we work with developmental program and also infrastructure, as we believe these are the requirements or requisite in terms of enabling innovation ecosystem. So we are dedicating a land within Meranti Park with a 10-acre land that we are currently building what we call an integrated healthcare cluster. It's basically the land itself will be equipped with relevant infrastructure to nurture the growth of healthcare innovation in Malaysia. For example, we'll have a testing facility, we have incubator, R&D center, training center, showcase, prototyping, and also small manufacturing facilities that will be offered to innovators, to our network of innovators here in Malaysia. So these are some of the achievements that we have achieved last year, or some are up until May this year. To date, we have 15 sandbox hospital partners that we are working closely with and are ready to be our test bed partners. We have established one national steering committee to oversee our programs and to provide facilitation to our innovators from the policy side. For example, if there's a need to update the regulatory framework, then we have that committee, national committee, to basically champion the cause to be escalated to the right agency. So this committee is being co-chaired by representative from the Ministry of Health, representing the health system and also regulatory sort of sectors. And another co-chair is from the Ministry of Science, Technology and Innovation, representing the innovation side. We have a profile 165. So I believe this was up until December last year. Right now, we have more than 200 already. As of May this year, we have managed to facilitate commercialization of 8 technologies and solution, local solution. We have impacted 1,642 entrepreneurs through our program, and we have been facilitating, as of May, 135 companies in terms of regulation, in terms of matching, strategic partnership, in terms of setting up a company establishment, in terms of market access, in terms of funding and investment. So it's one of those things. And here I highlighted two of the commercialization cases that we have facilitated in the past 1.5 years. Number one is Senior Connect by QMed Art, Asia Senior Berhad. So it's a local company. Basically, it's a combination of telehealth and IoT that's been designed for post-discharge patient, particularly targeted for senior citizen. Another technology is called Lega by Formeditech Sdn Bhd. So it's sort of a percussive technology to basically support and to relieve you of your respiratory blockage problem through your respiratory channel. So this is the end of my presentation. Thank you, everyone. So if you would like to collaborate with us, we can be reached through this QR. Scan this QR and send your email to us. We are happy and looking forward to any collaboration proposal with any partners that we can basically have a win-win collaboration with. With that, I would like to end my presentation. Thank you very much.
Thank you, Dr. Hazwan. Next, let's have Fujita-san. Fujita-san, please.
Excuse me. So hello, and thank you for this precious opportunity. My name is Takanori Fujita from Tokyo Foundation for Policy Research, and also Project Associate Professor of Keio University and Nagoya University. Today, I would like to talk about the state of digital health in Japan. I'm originally a medical doctor, and I'm doing research in healthcare laws and policies. And in addition to research activities at several universities, I have collaborated with the Health and Global Policy Institute and also the World Economic Forum. And during the COVID-19 era, I also served as a government expert on Japan contact confirmation app called Cocoa. Now, here's the state of digital health in Japan. Many efforts to digitize healthcare began in late 20th century Japan. However, as Katrina mentioned, digitalization of healthcare in Japan is lagging behind even in ASEAN. The adoption of healthcare medical records is behind global standards. And but the telemedicine has progressed since COVID-19. And the government is currently promoting medical digital transformation, medical DX, which includes the development of a national medical information platform, EHR, and a promotion of personal health record, PHR. Unfortunately, the vision and the brand design are not well explained by the government, leading to insufficient public understanding. There's numerous issues, and including legal arrangements for the secondary use of data and AI implementation. Digitalization efforts in general in other fields like mobility or finance are more advanced than that in healthcare. But there are some healthcare startups that are also operating in ASEAN, and the Japanese government is supporting healthcare startups also. From a regulatory perspective, legislation is still in development in Japan. We have Personal Information Protection Act and Next Generation Healthcare Infrastructure Act uh, for secondary use of healthcare data. But further review of Personal Information Protection Act and other medical regulations is needed to promote digital health. One big issue is about the consent. Consent is emphasized under Japan's Personal Information Protection Act, which poses a barrier to data use. Therefore, I have proposed the APPA concept at World Economic Forum as a model to promote data use. APPA achieves the desired value by allowing access to data for specific uh, agreed upon public purposes, such as medical care development or public health improvement, or like these examples, without necessarily requiring explicit individual consent, while guaranteeing individual human rights in other ways, like checking up by third parties. In Japan, now we are promoting the use of pseudonymized medical information, similar to the APPA concept, or referring to EU's European Health Data Space Act, EHDS Act. The idea is to use data after a certain level of screening, say exit regulation, and even if the concept is not necessarily obtained. And this is the model of Next Generation Healthcare Infrastructure Act, which was revised last year. Sorry that this is only a Japanese slide. From this year, pseudonymized medical information has been made available to pharmaceutical companies and other companies, and through these three governmental approved companies. And there are also efforts to promote digital health in some progressive municipalities, like Digital Garden Health Special Zone. But digital health, including PHRs, are not necessarily advancing in all regions or in all municipalities. So to support their efforts, we have issued guidelines in June this year. I'll skip the video. And the look for AI, especially generative AI, is also important recently. And the EU passed the AI Act this year. And in Japan, the Ministry of Internal Affairs and Communications and the Ministry of Economy, Trade and Industry have published new AI guidelines for businesses. There are also ongoing discussion about whether to create more hard laws in addition to this guideline. And in healthcare field, private sector guideline on generative AI was issued this year. And in the future, for international coordination, we have to make these kind of common rules. Finally, I'd like to introduce the Trusted Web initiative from Japan. So there's a concept called DA50, data free flow with trust, proposed by Japan, which is for the data distribution globally. And in current internet, there are many data which was not checked the fact, and so we have to trust the data. Or in mechanisms like blockchain, which can verify almost everything, but it costs them many high costs. So we are working to create a new balance model called trusted web. And also, we have just released the white paper version 3 in English, so please check it through the website. And we have already examined 2 use cases for trusted web in healthcare domain. This one is for the clinical research, and another one is about distribution of healthcare data using IoT device, shoe sensor. And the trusted web model promotes reliable data distribution, both domestically, mean in Japan, also, but internationally. So I hope this concept or mechanism are used in collaboration with ASEAN and Japan. So this is my end of presentation. Thank you very much for your attention.
Thank you very much, Fujita-san. Next, we have Miss Lu. Miss Lu, please.
Hi, thank you for having me. It's an honor to be able to share what we are doing in Singapore and DXD Hub with the ASEAN-Japan Center. My name is Yuan Lu, and I will be introducing a little bit about what we do at DXD Hub, and then also how we participate in this national level digital transformation of healthcare in Singapore. So quickly, actually, DXD Hub is a national platform with a dual mission that was set up in 2014. So we are 10 years old this year. And we basically recognize at the get-go that there are 2 different gaps in terms of like getting innovative diagnostic product out. One is actually to making the product, making sure that it is actually developed in a way that is robust and effective, safely and effectively, and then also to make sure that it's scalable. Then the other part is really to catalyze, the diagnostics ecosystem to use it, because these are novel products, and most of the time there will be a lead time for the ecosystem or the healthcare ecosystem to evaluate and adopt the product. So to get there, actually, we have a small lab of about 80 plus people, and they are falling within this type of skill sets. They have this kind of skill set. So just briefly, we have expertise to develop traditional type of in vitro diagnostics, such as the qPCR, immunoassays, histology, and so on. We also have started back in 2018 to look into software as medical devices. And then more recently, due to COVID, we realized that there's always a bottleneck. No matter how well you try to develop a workflow, when you have crisis, you always find yourself in a scramble. So with COVID, we also started to look into seeing how we can develop the next generation of diagnostics that can integrate data flow, information flow with the actual bench testing. So to support all these products, right, we actually have a regulatory team and also a quality assurance team to make sure that, things that is developed here is aligned with the various regulatory requirements of the major markets, US, Japan, EU, ASEAN, and so on. So these are the part that we basically put together to develop the product. And the second the chasm, right? The gap of deployment. So what we did was also to kind of set up a clean CAP accredited clinical lab at our site. So this serves as a purpose to basically look at the novel diagnostics that we develop. The deployment site also has their regulatory requirements. So we are putting efforts to understand those things so that, for the products that we develop, we know how to navigate those processes to get it out into the market. And I think I don't have to share this. I think I'm preaching to the choir, but basically, we do have a very robust process that is actually mapped to the regulatory requirements that is stated in ISO 13485. And these are the areas that we are working on. The priority areas, as you can see, precision medicine, women's health, and infectious diseases. Precision medicine, a lot of all the innovation is coming through based on, genomics advances, digital health processes, etc. Infectious diseases, I think everybody knows that Singapore is a very small economy and open one. So, we have to kind of be vigilant, on the watch of maybe what's the next pandemic. Women's health, why? I think women's health, today, women makes up half of the world, and then I think they have a lot of the responsibilities in terms of taking care of needs from the birth to the elderly, taking care of their parents, and a lot of home care. So I think we want to dedicate some time to basically look at, if there are any needs that we can innovate for women's health in when our resources are available to do that. We mentioned about, the capabilities that we have just now already. So that forms like the basic scope of what we do at the XD Hub. I want to also touch on this thing, this initiative that was set up back in 2018. Under ASEAN, there's actually 3 pillars. There is a pillar called the Committee of Science and Technology and Innovation, in short is COSTI. And the ministers in COSTI actually encouraged and also endorsed this particular initiative known as ASEAN Diagnostics Initiative back in 2018. It was formed, and then, very quickly, COVID actually fell on us. And I think it was very timely. We basically did quite a bit of capacity building type of activities, sharing, networking platforms, and so on. The main objective of this platform before COVID, right, I think when we were setting up, it was really to see whether we can empower ASEAN scientists to come together, scientists and clinicians, right, to come together to develop products that was relevant for ASEAN. And this is something else that we do. We actually also is part of the Singapore's Prepares programs set up to look at the type of diagnostics that may help us kind of also, make sure that we are prepared for the next pandemic, right? So these are some of the objectives of the cooperative. And just the next few slides is just to show what we have done, to demonstrate that, we actually do have quite a few examples that we have developed over the years. This set of products was actually for the pandemic response. Fortitude was actually a qPCR test that was developed within 2 weeks and eventually deployed to more than 45 countries. And Resolute was actually kind of a response to the spike in terms of the outburst of the spike in COVID cases when we start to see that the outbreak was going to strain considerably on our resources in terms of supply chain as well as manpower. So this was a direct qPCR that basically reduced the time for sample to results within about 45 minutes. Then these are some of the other things that we have been doing. So in the precision health level, we have early detection kits for gastric cancer that we developed with a local innovator, local startup, and also with another startup. This is actually a pan-cancer genomic test that is dedicated towards like Asian-centric tumors. Then in the digital health side, we have been working with a few companies as well. These are just two examples. FX Memo is actually in collaboration with NUS and NUH in Singapore, and this is to improve the predictive accuracy of digital mammography. And AI Triage is actually another collaboration that we have with SGH, Singapore General Hospital, and another startup, a spin-off from SGH, to look at basically triaging for major adverse cardiac events cases. Right. So maybe I'll just spend a couple of minutes talking about this new initiative that was launched last year called the Digital Health Accelerator. So this is basically a joint platform by A*STAR, Ministry of Health, SingHealth, NHG, NUHS, and Synapse, right? So this represents both the innovators and the medical clusters that is actually running the show in Singapore. So this is another representation, right, of what we said showed just now, but customized more to digital health. And you can see that for the productization side, right, these are all the different types of requirements that has to be fulfilled before you have a product that can use for diagnosis, for diagnostics. And then on the other hand, for digital health products, right, they have an additional challenge of trying to make sure that they can also fit into the current workflow in the hospitals. And then also, as the previous speakers has mentioned, all the requirements to fulfill cybersecurity, interoperability, and so on and so forth. So the DHA Digital Health Accelerator was kind of set up to kind of bridge these gaps. And what they do, basically, they combine all the resources of the organization you saw just now. That's 7 organizations, and we can actually help with productization of an innovative product with the insights of what are the challenges that is going to be faced by the medical clusters, medical hospitals, right? So with a little bit of foresight, we hope that we can actually help in terms of like the adoption, the scaling and adoption of the digital solution. So this is this is a very busy slide, but basically what it captures is the kind of activities and who is able to do what, and how does DHA then come in to basically support the ecosystem. The last 2 slides, I just want to do a shout out to actually our regulatory authorities as well as MOH. I think the process or the pathway that we have followed in terms of enabling digital healthcare in Singapore kind of mirrors what Dr. Navallo actually mentioned just now. So It has started quite a long time ago. I believe, from the research I've done, is like from 2018, 2019, and all the way to now. The HSA has actually come up with quite a bit of resources, efforts to come up with resources to address the understanding of regulations in this space. So this is just a screenshot of their landing page. I think if there's any interest to understand how Singapore does it, most of the regulations and guidelines are actually published on this site. So this is, in a way, it kind of, from HSA angle, these are actually how they look into the different types of products or services that will pave the way for digital transformation. And you can find within the link to the description of what they are and how is HSA looking at coming up, developing the guidelines for all of these different products or services. Then on the other hand, MOH I think back in 2021 has also published, again, is a cross-sectoral joint effort, right, with different agencies as well as universities and acad groups to address more of the how-to kind of guidelines for innovators that is interested to develop this type of products for the deployment in Singapore. So I think all the resources are actually online, and if there's any interest to understand more of them, I am more than happy to provide the links or further discussions on this part. I think with that, this is my last slide. So thank you again for this opportunity to share. I'm looking forward to the panel discussions in a while. Thank you.
Thank you for that, Ms. Lu. And lastly, we have Abe-san. Abe-san, please.
So firstly, thank you for giving me a very special occasion. My name is Kazuma Abe. I am CEO of Medlink. Actually, I am totally different from other partners. I am just a CEO of startup. Anyway, let me introduce my company and strategy. So firstly, our Medlink. Medlink is making smart clinics in ASEAN nations as clinic management system maker, and also we do operate clinic itself in ASEAN. Our mission is universal health coverage by digital transformation. And vision is contribute to development of clinics in ASEAN. We are now located in Vietnam, Indonesia, and also we have already customers in Cambodia. Just brief my introduction. Actually, I was born in Japan and Kagoshima Prefecture, and graduated from the University of Tokyo. And as ASEAN Center told, I was a former government staff, Ministry of Economy, Trade Industry. I worked in consumer protection and energy, and also actually digitize medical and other service sectors. After working some places, I established Medlink in 2019. Our business scheme has two kinds of business models. One is a clinic management system. This is we call EMR or a hospital information system. And also we do operate a clinic itself, right now in Vietnam, and we will make it in Indonesia soon. So firstly, our system we call MEDI. MEDI is a kind of management system for clinics, middle-sized and small clinics. This system can manage reservation and also, of course, storage of any data, lab data, image data, and of course support diagnostic processing and prescription, something like that. Any operation can be supported by our system. Current status is we already got more than 100 users in Vietnam, Indonesia, and Cambodia. And our current direction is, of course, we will continue to develop more in order to get satisfied from customers in ASEAN nations. One of feature is our product price is very reasonable in order to attract even small clinics. So that's why our price is very reasonable and also very easy to use and easy to save data. It is a feature and it is just one example of diagnostics screen. It's very easy to see and easy to write down as a result. It is a good point of our product. Also, we do manage, we do operate clinic itself. Right now, internal medicine clinic in Vietnam. Of course, our system, our product manage our facility, and also we educate staff, medical staff based on Japanese medical care knowledge. And right now, actually, we are now preparing for smart home care clinic chain, especially for elderly people. Firstly, in Indonesia, like this. Actually, we will use medical MARS. Medical MARS means kind of a mobile clinic that has internet with help of Starlink. And also, we will have kind of equipment, also for system including ours, and we will utilize even AI to diagnose and to support operation by nurses, something like that. In order to achieve Japanese quality medical care, especially for elderly people, because maybe as you know, the number of elderly people are growing rapidly, even in Indonesia, even in Vietnam. Of course, already in Singapore, Malaysia, Thailand, so many elderly people. But up to now, actually, the number or ratio of elderly people in ASEAN nation is not so high. So that's why not so many specialists and not so many facilities specialized for elderly people. But in opposite, in Japan, as you know, there are so many elderly people since 30 years or 40 years ago, and so many physician specialists for elderly people. So that's why we Japanese had already kind of a good knowledge of elderly care. So that's why we are now thinking about combining Japanese medical knowledge and also our medical equipment and technology into ASEAN elderly care market. So that's why we are now thinking about it and we are now preparing for it. My presentation is very short, but this is last page. As I told you, I want to do combine Japanese medical knowledge, multiple digital solution, maybe equal Japanese quality medical care in ASEAN, especially elderly medical care is, I think it is really urgent matter for any ASEAN nations because they don't have not so well knowledge right now, but Japanese, especially Japanese physicians, specialist physicians have so many knowledge. So I feel this is really good example of collaboration between Japan and ASEAN nations. Thank you for listening. That's all.
Thank you for that, Abe-san. All of your presentations have given us some substantial insights in preparation of our panel discussion and open forum. With the limited time we have for today, I'll leave this discussion in the capable hands of Dr. Navallo. Dr. Navallo, please.
Thank you so much, Aurora, and for our speakers for sharing such insightful status of the latest developments of digital health services in their respective countries, particularly in Malaysia, Japan, Singapore, and Vietnam. We are now left with 20 minutes to have our panel discussion, and our discussion will look at the specific challenges and opportunities in digital health for both the governments and private sector to realize increased cooperation and trade in health services between selected ASEAN countries and the region. And this afternoon, we have with us innovators and government enablers or accelerators. And I guess in the interest of time, we'll have 3 rounds of questions. But first, I would like to throw out this question in terms of medical data protection and cybersecurity. So I'd like to ask this question to Mr. Abe. Given the challenges of cybersecurity threats, what do you think is the key point in attaining the trust of patients in Vietnam that use the Medi platform? And how do you address the concerns surrounding medical data privacy and security of patient data?
Thank you for asking. Firstly, our system itself has kind of some layers to protect personal or medical information, like, of course, including encrypted. And of course, not anyone can access. We can divide kind of power of right to physician and to manager. It's kind of possible to be divided by each medical professionals. And also, actually, but most important thing is we are cloud-based software company, and we are now using AWS. Of course, and Amazon invested so many cash to get security. But traditionally, especially in Japan, many physicians think on-premise is safer than cloud-based. I know their feelings, but if they do use on-premise database, they have to hire many professionals in order to avoid kind of cybersecurity issues. And many problems happens, especially in on-premise facility. So that's why we are now persuading many physicians to use cloud-based. It's safer way to get protection. So it is my answer. Thank you.
Right. Thank you for pointing that out. At the moment, I think there is still ongoing debates and discussions regarding whether an on-premise or an online data provider such as AWS and also other platforms are sufficient in order to secure or like maintain a level or standard of security, especially of medical data. I guess I would like to throw the next question to Ms. Lu. In terms of the government perspective, especially in Singapore's case, what strategies have been taken by the government to ensure the protection of patient data while enabling data sharing across the public and private health and medical providers?
Thank you for the question. I'm not sure whether I have the full picture, but I think at a high level, what I can see that the government is doing, they are trying to tackle these issues about adopting digital health in 3 areas. One is basically in terms of like making sure that the regulations are in place, to safeguard, including cybersecurity, privacy, and also interoperability issues. Then the other 2 areas, one is to address what the innovators should do, right? So the guideline that I showed just now called Agile is basically something that is communicating to the innovators, like, if you're going to develop digital health solutions, please make sure that you use this checklist and see, and use it to guide yourself. The last area is basically how do you tackle the awareness, the adoption, right? It's easy to talk to the scientists or the technical people because they understand, the in and outs of what is a software, where do I give consent, don't give consent, that kind of thing. And what does the consent mean in terms of the software? But for the general public to actually accept that digital health has all that benefits that's going to come and, transform the healthcare delivery for all our benefits, you need to actually engage the society, the population early, and in a way that, people understand what this is about, and, the roles and responsibility of the healthcare providers, the innovators, and so on and so forth. So I think Singapore has a few regulations that guidelines and regulations that helps to address that. One thing that was done more recently, and I think it's still a bill, not passed into an act yet, is the Health Information Bill that talks about, what kind of information is safe to share, how do you collect, who is supposed to be contributing those information, and so on and so forth. Then there's also that Healthier SG that we have been that has been rolled out in July last year, I think. Basically talks to the population about how digital health is going to be beneficial for people, and then it's actually a pretty broad-based program that engages the population, the caregivers, at the family clinic level, as well as all the way to the acute care hospital. So I think it's through this type of integrated, connected type of communication and guidelines development that we are addressing these issues. Thank you.
Thank you, Ms. Liu. I think you also touched on a very important aspect of building the culture of trust is to integrate the culture, as you mentioned. And one big part of that would probably fall on public education in terms of what the society knows, or how they can better protect themselves in terms of accessing the data and giving their consent and all kinds of access to their data from the service providers. I would like to get back to Abe-san. In Vietnam, I believe that there are current government initiatives to build and strengthen trust in medical data privacy. Could you share more about that from your experience?
All right. Right now, Vietnamese government is making general, not medical one, generally personal information protection law. It is not effective, but they already made the draft. And right now, they are making kind of a penalty, the details of penalty. And also, they are thinking about medical data protection, but it is not effective right now, and they don't have kind of the details of roadmap. But maybe, as you know, already even Indonesia has the rule of medical data protection. So I will anticipate Vietnamese government will make soon, maybe within some years. Yeah, so it is the information I got.
Thank you so much for sharing that with us. Recently, a number of guidelines and policies concerning the use or governance of AI have been released. In January, the ASEAN guidelines for AI governance and ethics have been released, and also Japan has released the guidelines for AI implementation for businesses, as mentioned by Fujita-san in his presentation earlier. Recognizing the growing relevance and growing use of AI as part of the emerging technologies for advancing digital health in ASEAN and other countries. I guess I'd like to ask again Ms. Yuan Lu in terms of what emerging technologies in Singapore are most promising for the country, and what can we learn from based from Singapore's context?
Okay. Well, on the technologies side, right? I think from what I can see, it's actually quite broad-based, right? So from innovative ways of looking at new biomarkers, through genomics, that's one. Using AI to kind of find a better predictive or analytical tool to kind of predict or monitor treatments is another. Telemedicine is there. And then also in terms of like, I think I'm not an expert in this case, but using blockchain for security, as well as also cloud-based type of technologies. These are quite prevalent. Yeah.
Thank you for that. And then I'd like also to ask this question to Fujita-san. You've mentioned a couple of technologies that the Japanese government is now promoting towards the more safe use and trusted use of AI and other forms of advanced technologies, not only for digital health, but for other industries as well. What do you think are the challenges of integrating new technologies into the existing healthcare systems? And can you cite an example from the experience of Japan?
Thank you. As I mentioned in my presentation, the Trusted Web Initiative is a very good example. We have already examined certain use cases as a whole and two healthcare use cases. The difficulty for bringing Japanese healthcare field, there's many difficulty. The biggest one is the regulation in healthcare field. So we have many regulation not based on digital technology. So we have to change the rules for healthcare. And also we are now tackling on the implementation of AIs, and we are also examining some use cases for usage of AI in healthcare field. Some is called AI hospital project, and which is to use AIs in hospital. And also we are now trying to build some large language machine learning model for healthcare, but it's a hard thing for hard trial now.
Thank you for sharing this. And then probably relating to the growing prominence of AI's use in this kind of technologies is the ability of the workforce to catch up with this kind of developments. And I guess I'd like to throw this question to both Medring and A-Star. What strategies do you need are needed at present to build a skilled workforce capable of advancing digital health? And if possible, can you give some examples of initiatives that you're working on to promote digital skills among health sector professionals in Vietnam and Singapore, probably? So if possible, I'd like to hear from Abe-san first.
All right. So as EMR, medical management system developer, we will to utilize our database into even AI. But firstly, we have to collect good kind of organized data, right? And in order to do this, physician and nurses have to collect and have to save data rightly, right? But if our system's UI, UX is not good, they will not do anything. And of course, maybe they do wrongly. So that's why, firstly, we are now focusing on making good UI, UX and kind of persuade physicians and nurses to save data rightly. So it is maybe first step and maybe essential step. Not only for us, but also for any other digital health startup and industry is necessary totally. That's my stance.
From Ms. Wan Lu.
Yeah, okay. So from our side, from Singapore, right, we take a coordinated approach. And prior to 2021, I think there has been training offered to improve the awareness about cybersecurity, privacy through PDPA and so on and so forth. But I think in What was significant was actually in 2021, MOH again released this set of guidelines called the Healthcare Cybersecurity Essentials. And I think, it basically details out the basic cybersecurity measures, that what it is all about, and then how it should be adopted to ensure the security and integrity of IT assets, systems, patient, etc., patient data, etc. Right. So I think it's good to actually have that kind of resources, assets, and then try to align to what this guidelines is about. In terms of examples, I think we've aligned with the HCSE, right? Quite a few of the higher learning institutes has actually rolled out different courses, including one that we do together with the Center of Regulatory Excellence. We actually do talk about digital regulations. How do you develop regular digital health products to meet these requirements? And the good thing is also, is as in a whole of government approach, right? A lot of these courses are actually supported by the SkillsFuture Singapore grants to help Singapore stay relevant in this very fast-moving sector. Yeah.
Thank you so much for sharing those perspectives. I think I'd like to ask this question to Fujita-san. Looking at the capacity building of the health professional workforce that have been shared in Vietnam and in Singapore's case, do you think Japan could benefit from participating in a cross-border trade in health service and involving mobility of highly skilled professionals? What do you think would be beneficial for Japan in such case?
Well, I think we can benefit from this kind of things, and actually, some organizations like Medical Excellence Japan or other private sector are working towards this goal. But I think we have some challenges. First is many in Japan we have some healthcare startups, but they are only focusing on Japanese healthcare system, and which is depending on Japanese regulation and of course Japanese. So we have to translate the literally and also technologically. So we have to see the common issues between Japan and other ASEAN countries.
Right. Thank you for sharing your insights. I think we're down to our last 2 minutes. So these are just rapid fire questions involving collaboration and partnerships between ASEAN countries and Japan. Again, to Fujita-san, how do you think can ASEAN countries and Japan collaborate more effectively on digital health initiatives?
How is a very difficult question. As you mentioned, Japan is not a leader of ASEAN in terms of digital health. So we have to, maybe Japan has to learn from other countries like Singapore or Malaysia or Vietnam. But we surely can collaborate and make some good products together to sell globally. Thank you.
Right. Thank you so much. And then for A-Star, Ms. Yuan Lu, any thoughts on how can public-private partnerships be leveraged to advance digital health in the region?
Yeah, I think we are firstly open to sharing all our experiences. So and for example, with this particular platform, I'm so happy that to be invited to share that what we are going through. It is a process. With some commitment, we will figure out how to really actually get to deploy digital health products in a country and then maybe to the region. So I do echo Fujita-san's comment that it's not easy, right? But I think it's through this kind of platform that we talk about different types of solutions. I am very intrigued with the trust system that Fujita-san mentioned, and then also how it can be potentially deployed to clinical trials. Maybe that's where we can first start, get a few projects that we can establish that particular network and then give it a try. Yeah, so I'm actually very hopeful. I think it is something that will transform healthcare and maybe bring all of us closer to universal healthcare. And I look forward to collaborating with Fujita-san and Abe-san as well.
I like that openness between our speakers. Thank you for pointing it out, Ms. Yuan Lu. And I guess from the tech startup perspective, Abe-san, if you are to have a wish list, what digital health exchanges would you like to have between ASEAN countries and Japan?
Yes, as I told you in my presentation, maybe in some categories, Japanese, especially physician, has good knowledge into ASEAN medical market, and also some Japanese company has well fortune. So I will persuade them invest into ASEAN medical market with knowledge and technology, and also or maybe through this investment, we Japanese can learn from ASEAN nations, especially Singapore and Thailand. They already have kind of very good digital health tech. So I feel from businessman perspectives, we can do collaborate between ASEAN and Japan. Thank you.
Thank you so much for sharing these thoughts. We would have welcomed questions from the audience, but in the interest of time, we regret that we'll have to end our panel discussion session at this point. Thank you so much to our speakers, and I would like to take this back to Aurora for her closing.
Thank you, Dr. Navallo, and our esteemed panel. We will send you the survey feedback link immediately after this webinar. And you can find here the QR code leading to the recent ASEAN-Japan Center publication on assessing digital health adoption in ASEAN. Thank you again for joining us today, and we look forward to seeing you in our next ASEAN-Japan Insights episode this September.